Hello, my name is Gracie Monsiváis. I am a clinical manager here at Pathlight Mood and Anxiety in Fort Worth, Texas. Here at Pathlight, we treat all adults age 18 and over. We have a PHP program and an IOP program here. The PHP program is a program that's run 7 days a week for 6 hours a day, and it's for the more acute patients. And then the IOP program is a 3-day-a-week program that's 3 hours a day. Some of the diagnoses that we treat here is any mood and anxiety related disorder, such as depression, anxiety, generalized anxiety disorder, bipolar disorder, obsessive compulsive disorder, or post-traumatic stress disorder. From a psychiatrist who's going to see a patient twice a week for med management within the PHP program. We have a nurse on staff. We have various master level clinicians that will conduct group. Upon admission of the program, a patient will be assigned a primary therapist that will be their primary therapist throughout treatment. The patient will be seen 3 times a week by this therapist in an individual session, family session, couples session, or their support system, whoever they choose they may be, can come in and participate in that session. All our clinicians are trauma-informed clinicians here. Here at Pathlight, we have very diverse programming, and some of the modalities of treatment include dialectical behavioral therapy, cognitive behavioral therapy, acceptance and commitment therapy. Another very important part of our programming includes exposure response prevention and behavioral activation. This is a very important component for those dealing with mood and anxiety for the reason that it exposes the patient to the very stimuli that creates a lot of the dysregulation or the painful emotions that they're experiencing. This is done twice a week within their programming. And this is when a patient sits with a therapist and they begin to confront in real time the exact topic or trigger or emotion that creates this dysregulation for them. They begin to experience these emotions as the therapist talks them down or gives them different coping skills on what they can use to better help them regulate their emotions again and find that happy place for themselves. Other components to our programming include seeking safety and also understanding mind and body. With understanding mind and body, this is very important for our patients to begin to experience things that are going to help them center themselves, such as meditation, yoga, mindfulness. Pathlight Mood and Anxiety is centrally located here in Fort Worth, Texas. Our goal here at Pathlight Mood and Anxiety is to provide a welcoming and safe environment for our patients. Our center is very serene and calming with a lot of natural lighting. Our group rooms are very spacious, so this allows for the patient's comfort that they're not stuck in a tiny little group room, but can spread out and feel comfortable. Collaborate with the patient's already existing outpatient team. From week 1, our therapists reach out to the outpatient treatment team and ask about their input on patient history or on treatment goals, and we keep it going from there. We touch base with the outpatient treatment providers weekly to give them updates or progress on how the patient is doing. If the patient comes in and they do not have an outpatient team already, that's where Pathlight clinicians do help in making referrals for therapists and psychiatrists so that this treatment does continue after completion of the program, as this will be and will play a crucial part in their success in continuing to manage their symptoms as they leave Pathlight.